When a person is experiencing a mental health crisis, it can be a distressing time, and they will often need specialist input from specialist mental health services. However, their pathway of care depends on the time of day that they present in crisis and how they access services. Our current services are: between 9 a.m. and 5 p.m, assessments are carried out in local areas by the crisis team following triage by the local duty desk. Between 5 p.m. and 9 p.m, all referrals for people experiencing a mental health crisis are made directly to the local crisis resolution home treatment team. Between 9 p.m. and 9 a.m, all patients are seen at the out-of-hours service in St Cadoc's Hospital in Caerleon in Newport. There are a number of challenges with the current system. These include access to the service is different depending on the time and the day of the week that the person needs the service. When a person experiences a crisis, it is not always clear who they should contact for help. And there is currently no single entry point into mental health services, and so people can experience different pathways and different service. We would like to make the process to access the crisis service to be the same for everyone, irrespective of the time of day you need to be seen. This is our proposal. We would like to develop a crisis assessment support unit that would operate 24 hours a day, 7 days a week. A crisis assessment support unit is a service where a person experiencing a mental health crisis can attend for a multidisciplinary assessment of their needs. This service would bring together the crisis assessment multidisciplinary team, the 136 suite, and the out-of-hours services for individuals experiencing a mental health crisis. All crisis referrals would be processed through a central booking office at St Cadoc's Hospital. Between 9 a.m. and 9 p.m, appointments will still be offered to patients at their local crisis resolution home treatment team. This would mean that between these times, the majority of patients would not see any difference in the way they are assessed. However, if there are no appointments available locally, an appointment would be offered at a crisis assessment support unit in St Cadoc's Hospital. Between 9 p.m. and 9 a.m, all people requiring a crisis assessment are proposed to be seen at St Cadoc's Hospital. This unit will also provide a single point of contact for the ambulance and police services, including individuals attending the 136 suite. We are suggesting that the most appropriate location for the crisis assessment support unit is at St Cadoc's Hospital, as this is currently where the 136 suite and the out-of-hours service are based, and it would mean that these services would work more closely together. The location would also be on the same site as the Adferiad Acute Adult Ward and the Psychiatric Intensive Care Unit, which would enable patients to be easily transferred between any of these facilities if needed. Ultimately, we would like to develop a new building to relocate these services into, and we have been in discussion with the Welsh Government about this. We currently have our 4 acute adult wards, geographically based, and they all provide the same function. All 4 wards provide both assessment and treatment, which means that the environment is not always the best it could be to support individuals in crisis or promote recovery. Current admission arrangements mean that there is a broad mix of patients on each ward in different stages of crisis, treatment and recovery. Access to the broad range of staff that support people with mental health needs, or multidisciplinary teams, is sometimes different across our wards. Over the last 2 years, a group has been established to look at different options for arranging our wards to better support the needs of individuals. The proposal from this work suggests potentially changing the way in which our wards work by moving to a new system which separates the crisis admission part of an individual's pathway from the recovery part of the pathway. Our proposal would mean that there would be one assessment ward that would take all new admissions across Gwent. Learning from elsewhere, we would expect that a single assessment ward would take all crisis admissions and would enable a team of dedicated specialist multidisciplinary clinical staff to undertake a comprehensive assessment of all aspects of the individual's needs. The length of stay on the assessment ward is anticipated to be relatively short and is typically 7 days or less in other similar units. After this brief period of assessment on the ward, it is proposed that each individual would then be transferred to a recovery ward for the remainder of their admission. There would need to be a number of recovery wards supporting this arrangement. We have yet to determine the number of these or where they would be located. The proposal to develop a single assessment ward with a step down to local recovery wards should provide a clear pathway for supporting individuals on their road to recovery. We believe it could provide a safer environment and enable individuals to receive more specialist care in more appropriate environments that are better matched to their needs. It is suggested that the assessment ward should be co-located on the same site as the psychiatric intensive care unit and the crisis assessment support unit, including the place of safety, the 136 suite. The proposal would then provide a single point of access for all agencies and for individuals presenting in crisis. We are also proposing that if there is a single crisis assessment ward, that this is located in a new specialist inpatient services unit if built. This proposed new development is further outlined in the main engagement document. The work to propose the location of the recovery wards has not yet been undertaken, and we would be interested in your views to help inform this discussion.